but I would really like to highlight three particular aspects that I think are important. The first aspect is one of awareness. Alexander technique is quite distinct from other therapeutic modalities in that it begins with an awareness on the part of the patient of what they're doing. And other therapeutic modalities require only that the patient be passive and something is done to them. So in the past I've been asked to compare Alexander technique to physical therapy or to chiropractic or to acupuncture. And I would say while all of those therapies are extremely helpful for a variety of reasons, none of them depend upon that first element of awareness on the part of the patient. So beginning to have an awareness of body use, body position, is the first step in becoming a good student of Alexander technique. Now the second step is the issue of relearning what we thought we already knew. As we get older, we settle into patterns of movement, patterns of posture, patterns of behavior that have been learned and influenced by things that have happened to us in the past. Sometimes those are maladaptive in themselves. Also, sometimes things happen to us that disrupt those learned patterns of behavior. An extreme example would be a patient who's had a stroke, for example, and can no longer move the way they've been trained by themselves to move. Or a patient who's developed Parkinson's disease, where they're dealing with a different set of control parameters in the move. So what Alexander technique does in a conscious way is force us to observe our behavior and learn more adaptive methods and approaches to move. It's very much reminiscent of how we all learned to move in the first place. Whereas infants or toddlers, we first developed a sensory awareness of our environment, and then we had an intention to grab something or go somewhere or hold something. And our brain learned from our movements how we were to organize that activity. Many people believe now that the initial purpose of the brain is not to teach us to think, but to help us organize how to move. And that these purposeful, intentional efforts to move get organized into a subconscious routine, so that most of us no longer think about how to walk, or specifically how we walk. But Alexander technique, in order to help us achieve change, forces that we look at what we're doing, that we understand how we're using our body, and it teaches us how to use our body in a more relaxed, a more balanced, a more pain-free, and a more natural way. It's through this step that oftentimes patients benefit from freedom from pain, can restore lost function. But that's not where Alexander technique really stops. This sense of awareness as step one, thoughtful, purposeful change as step two, can be transferred from the world of movement to the world of emotions and behavior. And in the same way we can analyze what's happening in a specific situation, we can thoughtfully look at what our instinctive response is to that, and then learn how we can find a more adaptive, more successful emotional response or intervention to that. So these are the three steps that I think define Alexander technique from the perspective of a patient.